Hello, my name's Kate Woods and I'm one of the infection consultants and lead for antimicrobial stewardship here at the Homerton, and I'd like to welcome you to World Antimicrobial Awareness Week. Antimicrobials includes antivirals, antifungals, antiparasitic drugs, but most importantly and perhaps foremost in most people's minds are antibiotics, and it's all about how we can safeguard antibiotics and antimicrobials in general for ourselves and for future health services and future generations. So here at the Homerton we're focusing on three key messages. First of all, antimicrobial stewardship is for everyone, and you'll hear from various other members of the team how you can get involved in whatever the role is that you do here at the Homerton. Secondly, diagnostic tools are key to antibiotic decisions, and we're emphasising in particular this week with the rising COVID patients that we're seeing the procalcitonin blood test, which we've had here available at the Homerton since May and is a useful way to help you decide whether your patient has a bacterial infection or a viral infection alone. And essentially, if the procalcitonin is less than 0.25, bacterial infection is unlikely and antibiotics are not recommended. But please do take a look at the section in the microguide entitled Procalcitonin Protocol, and that will give you more information about that. And thirdly and finally, we want to make sure that we're using the right drug by the right route for the right duration in every patient. And Louisa, our antimicrobial pharmacist lead, is going to be telling you a bit more about that. So thank you very much for your attention, and please don't hesitate to get in touch if you have any questions or would like to get more involved with antimicrobial stewardship here at the Homerton.
Hello, I'm Dr. Lena Claxton. I'm the infection control doctor and Dipsy at the Trust. Now in the era of COVID, it's more important than ever to be absolutely precise with your antimicrobial stewardship to minimise the risk of outbreaks of any other bug.
Good afternoon, my name is Louisa Paparo. I'm one of the clinical nurse specialists. My role is invasive devices and the OPAT service. Part of my role is to help promote and educate the nurses regarding antimicrobial stewardship. Nurses are vital in their goal of enhancing antimicrobial stewardship. We spend the largest amount of time with the patients, educating, supporting and administering antibiotics. We are duty bound as well as morally bound to ensure we are promoting correct use of antibiotics and reducing its use when it's not clinically indicated. Ourselves, our families and future generations depend on this to ensure we have enough antibiotics to use in the future. What I've done this year to help support, educate and promote nursing within the nursing is create a learning package for the nurses, which will be uploaded as an interactive learning module on ESL. Currently, I'll be on a Zoom near you.
Hi, I'm Tanzina Khanum. I'm the Junior Doctor Representative for the Antimicrobial Management Group. What my role includes is being a sort of a hub of information for the junior doctor cohort and providing a link between the microbiology team and the junior doctors. And it's to emphasise the role of junior doctors in antimicrobial stewardship. So as part of Antimicrobial Awareness Week, I wanted to highlight the important aspect of our role when it comes to prescribing antibiotics. So we should remember to review the drug charts for our patients daily to ensure that we're not prescribing anything in error or unnecessarily prescribing antibiotics. And we should also remember to put clear documentations about the indication and the duration for the antibiotics in patient notes as well as on the drug chart.
Hello. My name is Dr. Deblina Dasgupta. I'm Medical Director at Homerton University Hospital. This is Antibiotic Awareness Week, and this is a good time for all us clinicians to remind ourselves of the importance of antibiotic stewardship to reduce the risk of progressive antibiotic resistance. Please do use the Homerton app for prescribing the right antibiotic for the right indication for the appropriate duration. Use the app. It is also available on the Homerton intranet site.
Hi, my name's Louise Egan. I'm Deputy Chief Nurse here at the Homerton, and as it's National Antibiotic Awareness Week, I just wanted to speak out to the nurses and raise the profile of antibiotics. So when you're doing your drug round and a patient's been on IV antibiotics for more than 48 hours, please speak to the medical team and ask them to review it. It may be completely appropriate they're still on the IV antibiotics, but what we need to avoid and must avoid is patients being on them for longer than necessary. And also don't forget about the Trust micro guide on the intranet, and that you can also download it on your telephone.
Hello. I am Luisa Cabrero. I'm a principal pharmacist for clinical specialties at the Homerton. And I would like to remind everyone that this year we, for Antimicrobial Awareness Week, we have a wealth of socially distanced activities that you can get involved with in order to help with the fight against antibiotic resistance worldwide. So for this year, I'd like staff to, generally everyone, can focus on two things. The first, every time you have a patient and they're on antibiotics, ask yourself, why are they on antibiotics? So is it because of the markers? Is it because of the fever? Is it because of the indication we're treating them for? So just, you should be able to explain this clearly to the patient. If you're not clear about it, then you will probably need to check. The other thing we should be focusing on is whenever you have a patient that is on intravenous antibiotics, we should try and query that with the team, if the patient is well and if they're eating and drinking. The reason for this is that there's quite a big benefit of switching them to orals because you remove a port of entry for any possible infections when they're staying in hospital. And also you reduce the burden for nurses in order to prepare all these antibiotics. It takes much longer for them than just giving a tablet. So if you can do those two things over the next week, that'll be great, and you will be well on your way to be an antibiotic guardian.